Good morning everyone. I am Dr. Satish Chandra, plastic surgeon. But nowadays I am doing mainly on cosmetic surgery and hair transplant. So in cosmetic surgery, apart from hair transplant, in male we get second most common condition for surgical treatment is gynecomastia. In other words, in general it is called male breast. How it happens, why it happens, difficult to say. But during development of late, because of more of sedentary lifestyle, less of activity, more of junk food, more of heavy nutritious food, these things can happen, more of obesity. But in this person he is actually muscular, mostly muscular. It is a single site. Usually gynecomastia male breast happens in both the breast. But in particular this person is 22 years old. Now he is having on only one side. And he is not obese. He has not put on weight. His fat is deposition of fat and gland is only on this area only. So it is mainly a congenital or during development some insult has happened to this right breast. That's why it has developed into a female breast. Now he is more conscious because it is unilateral, one-sided. So he'll be more worried. That is why he is here. Now how it can be done, how it can be removed. Now he has come with, now we are planning to do, now I am doing an assessment how it will be. Now I'll ask him to contract his muscles, basically chest muscles. So he'll be placing this hand here and contracting, like pressing hardly. So what happens? This muscle get contracted, pectoral muscles, both the sides. See, now you can see here hardly any gland or little gland which is normal. Little gland will be there in everybody. But on this side you can see a real projection of this much of fat. In gynecomastia, what will be there? Usually there will be a fat deposition and a little amount of gland. And in this case, in this person especially, more of gland will be there because it is more of congenital, not due to sedentary activities, not due to fat deposition. So it is a combination of fat and a hard structure, that is gland. So now we are planning to remove the fat. Removal of fat is liposuction. Whether fat is here, here or here, or wherever, we do a procedure called liposuction and we remove the fat. Now in this person, how we will be planning? Here in this person we will be doing under local anesthesia, not general anesthesia. Otherwise, usually we will be doing under general anesthesia where he will be unconscious, he will not be knowing what is happening and he will not have pain. And in here we will be doing local anesthesia, means he will be aware of doing things but he will not be having pain. So for that we will give anesthesia to this part, that is local anesthesia. Now basically removal of fat and removal of gland. So we are going to remove fat removal with liposuction and then we will make a nick or a cut here and remove the gland. That is both fat and as well as gland removal. Okay, that is about male breast. So later on, following removal of fat, this becomes or shrinks and the gland and fat will be removed. Skin shrinks, and during the procedure of shrinkage, we give a pressure garment, a jacket, which he will be wearing for at least 1 month, and the strain and everything becomes normal. That is how we do routinely. Okay, thank you. Yeah, now I am doing liposuction. Fat being aspirated from here, it goes like this into the container. Yeah, now I'm doing liposuction. This is a machine, these are the cannula. This is the cannula where it has multiple holes. These are the fat which being aspirated and goes inside like this for suction into that container. As you can see, this is vibrating. This is power assisted. This is power assisted machine which vibration happens here in the cannula. Okay. Okay. And okay. What I was telling earlier, the gland which is popping out now. Okay, this is the gland. Okay. 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 The full gland, you can see less of fat, purely a glandular type of gynecomastia. Okay. Yes, please.
ಇದು ಬರ್ತಿಲ್ಲ ಸರ್ ಸ್ಟಾರ್ಟ್
Okay.
ಮಾಡಿ
Okay, now I'm suturing the incision. I'm suturing the incision with the sutures, closing the incision. Incision means the opening which are made in the areola. I'm closing it. Okay.
ಸ್ಟಾರ್ಟ್
See, after the end of the procedure, we have closed this stitch, close the wound like this. With this small incision, we could able to remove this such a big tissue of gland from a small incision, which was only possible because of our technique as well as the liposuction. Once we do liposuction, there is no fat in this. Okay, so this is purely a gland and which will not come in liposuction. So once liposuction is done, fat component is gone. This is purely a gland. As I told earlier, it is more of a congenital, more of a developmental, not of due to obesity. That's why it is unilateral. So once I now after, because of technique, we could able to do with a smaller incision. Otherwise, we used to do a small, large incision if we were doing large 10 years earlier. So those days we used to do cut here, longer incision, ugly scar over the skin. Now this scar is between the dark skin, that is areola, and the normal skin, which will eventually will not be visible. Say after 3 months, 6 months, it will not be visible at all. So this because of this small incision we could able to take such a gland, all because of a technique and magnification as well as visualization and the light. See, I have a light in my head. This is a headlight. Apart from that, so the light, we have fiber optic light which goes from this cable. How much is it? And okay, with that light only. With that light which goes through this retractor, and once we see that, we can able to see the inside with a smaller incision and dissect. So light in the head as well as light in the instrument. Okay then? Yeah. This is what open. This is the light which I was telling. This one light here, headlight, and this is the other light. So you can see this light. This is the light. This goes through the instrument and passes through this and comes light here. You can see the light here now. Yeah. And once we go with this small incision, the light which goes exactly where we are going to dissect it. Now it's so, with all this instrumentation and technique, we could able to do this procedure with smaller incision. Smaller incisions, early healing, less pain, less scar. Okay, now we're going to give a pressure garment in the form of jackets, which will be shown now. Okay. Okay, done.
Start.
Yeah. Now we have put the pressure garment. This is just tight enough to compress the area of the dissection, and it also helps in shrinkage of the skin, which is lax because we have removed the gland and male breast. And the skin is going to adapt to the body. The stretch of the skin becomes normal, and that will be held by this pressure garment, which is going to wear this proper shape, proper size and shape. Okay, right, this he will be wearing continuously for at least 2 weeks. After that another 2 weeks, so 4 weeks maybe. Okay, done. Yeah, this is the amount of aspirate which we did, which is showing 600 ml, but the fat is only around 200 ml on this top layer. The lower part is the saline which we have injected. So 600 out of which 200. Okay, this is the amount of aspirate which are done by liposuction. Okay.
Start.
Yeah. Now we have put the pressure garment. This is just tight enough to compress the area of the dissection, and it also helps in shrinkage of the skin, which is lax because we have removed the gland and male breast. And the skin is going to adapt to the body. The stretch of the skin becomes normal, and that will be held by this pressure garment, which is going to wear this proper shape, proper size and shape. Okay, right, this he will be wearing continuously for at least 2 weeks. After that another 2 weeks, so 4 weeks maybe. Okay, done.